We begin with big developments in the fight against the coronavirus. Federal health agencies have called for a pause in Johnson & Johnson vaccinations over blood clot concerns. California and San Diego County have said they will stop administering those shots. And we have team coverage of the story today. Chris Beal spoke to a healthcare professional about the blood clot issue, but we begin with Misha DeBono with the impact of this decision. Good afternoon, Misha.
You'll be hearing this a lot. We are pausing the Johnson & Johnson vaccine out of an abundance of caution. You'll be hearing that a lot in the coming days. It's a good thing. It's going to give researchers time to look at all the data and just really figure out what is going on here. But we want to be clear that this is very, very rare. 6 women out of 6.8 million people who have gotten the vaccine have had this rare blood clotting issue. And it is very serious, though. One woman died, the other in critical condition.
We want to continue to operate out of an abundance of caution.
County Supervisor Chairman Nathan Fletcher addressing the concerns Tuesday after the county follows federal recommendations to pause the use of the Johnson & Johnson one-shot vaccine.
This will be a minor disruption for folks who had a J&J appointment, but the number of J&J vaccines in the San Diego system was exceedingly low. I think nationally it's been about 3% of the total. That probably tracks around here locally.
The J&J vaccine was mostly used in an effort to vaccinate hard-to-reach communities, offering the one-and-done shot to make it easier for those without access or ability to travel once, much less twice, as needed for the Pfizer and Moderna vaccines.
We're presently reassessing what vaccine is used for homebound seniors, agriculture workers, some of those harder-to-reach communities. We're not going to leave those communities behind.
It's expected this pause will be short, only a few days, to better understand if any connection exists between the clots and the J&J vaccine. In San Diego, there are no reports of blood clots associated with the vaccine. Symptoms include sudden and severe headaches, abdominal pain, or shortness of breath.
I think the two things that are important to note is, one is how exceedingly rare these instances are. I mean, what I've been conveyed to me is we're talking about less than 1 in a million that they had any situation. But if anyone has any concerns, they just need to contact their healthcare provider.
Yeah, and another effect of calling for a temporary pause is to make sure that the message gets out to doctors when patients present with the symptoms. And another interesting point is that these blood clots are unique, so you can't treat it the way you normally would, and doctors need to have that information as well. From the County Admin Building, Misha DeBono, Fox 5 News.
All right, Misha, thank you.